Hi, everyone, and welcome back to the Mind Movement Health Podcast. I'm Kate Boyle, your host, and I'm very excited. I have a special guest on the show today. Michelle, welcome to the podcast.
Thank you. Thanks for having me.
Now, before we dive in, because today we're going to be talking about dentistry and oral hygiene, can you please introduce yourself to our listeners?
Yes, so I am what I call a health-based dentist. And if you want to know my story, I can kind of walk you through how I got to the point I'm at now. I am a general dentist, so I was practicing dentistry, the kind that you probably know about, the fillings and cleanings and all that kind of thing. And I started getting really sick myself. And I didn't know what it was from. And I was going to every doctor and doing tests and procedures, and nothing was really helping. And finally, I actually had my practice for sale. I didn't think I was going to be able to continue. I had my hands were so numb that I couldn't even change. I couldn't hold instruments anymore. I couldn't do my job anymore. I couldn't think. I couldn't remember names. I couldn't remember details. And I put my practice for sale because I couldn't do my job anymore. And finally, another practitioner I was talking with him about my struggles and what was I going to do, to support my family and all the questions you think about at that time. And he said, have you ever looked into mercury as a problem? And I said, I don't know what you're talking about. I don't have any fillings that have mercury in them because I knew that silver fillings do have mercury, but I didn't have any myself. And he said, oh, no, it's not the fillings that you have. It's the fillings that you've been drilling out for the last 10 years, breathing it all in, no protection. And that was literally the first time I'd ever heard about that and ever heard that it could be concerning for me at all. So I got tested, and that's what it was, mercury poisoning off the charts. So I had to figure out how to get it out. And the doctor said basically, you can't get it out if you keep putting it in. So you've got to figure out a way to get rid of this and not, if you're going to keep being a dentist, you have to figure out how to not get more mercury in. So I found out there were organizations that did this. They called it safe mercury removal. So I started doing it, and my patients started asking what in the world I was doing. Like, did I go crazy, or what were these, special masks I was wearing? And we were covering them and giant vacuums and so then I would explain, and they would say, "Oh, that's interesting. Well, I'm glad you're doing that, for my health too." And eventually they would start telling their doctor about me, and their doctors would start asking questions, and it just kind of snowballed. So it's nothing that I intended to do or intended to learn about, but I'm very much a questioner. If I don't have an answer, I'm going to go find one. So I would just keep looking for answers, and eventually found so many things that we just simply don't know, don't talk about, that relate the mouth to overall health. And that is really what I've spent now the last decade teaching and learning about and educating and just trying to get the word out about it, because there is such a connection here that people don't realize. And it's something that we can do something about. So, really important to share.
And I mean, that's an amazing story. And it would have been a super scary time to be going through all that and nobody really having any answers for you either.
Yep. Yep. Exactly where it was. And now I see all those, my patients are those people that, they're me. They're the people that have had no answers and have all these health challenges and issues and don't know where to go. And so it definitely makes it easy for me to empathize because I've been in their shoes.
Mm. And what are sort of the main health disruptors of, oral hygiene, and what should we be focusing on as, just the person that's going off to see the dentist?
Yeah. So there's really I call them the big three that can be found in the mouth that really do affect your overall health. The first one is the one I was affected by, which was metals. So metals in the mouth, and every single one of those what we call silver fillings, is actually 50% mercury. Now, I don't know about where you are, but here in the United States, they're still completely legal and able to place them in any mouth and any age. It doesn't really matter. And nobody talks much about it. The fact that mercury, when the fillings are drilled out, is released. When you chew and you have those fillings, it's released. That mercury is released. So not a lot of people talk about that one. So metal is the first one. The second one is hidden infections in the mouth. And common places for those are underneath old root canals and where teeth are removed. You see a lot of hidden infections hiding there. And then the third one is actually being able to breathe and getting enough air in. And can you get enough air to really get you into a good sleep pattern, good sleep, deep sleep, so that your body's able to restore? So those are the big three that we see that are problems. that can affect your health if you have those things going on in your mouth. As far as, keeping your mouth healthy, a lot of that has to do with the things we already talked about, just brushing your teeth and how do you do it? And there's definitely some things I've learned in those areas too. So we can go whatever way do you want to go? What do you want to know more about?
Let's start with fillings, because if people have those silver fillings, what should they do?
Yep. So the key is to get them out safely. And there's an international organization called the IAOMT that does provide protocol for safe removal. So if you have these fillings, research does show that mercury is released from them 24/7. Literally every single day, every single time you chew, every single time you put your teeth together, you're going to get some mercury. But you're going to get a lot more mercury the day that those fillings are drilled out because it's being released as that drilling is happening. So you want to make sure that if you're going to get them removed, you're going to do it safely, where they do a detox ahead of time. You get your body ready to get rid of the mercury that's going to be released, and a lot of safety precautions. So when you get one of these procedures done, what you're going to notice is they'll use a dental dam in the mouth so that it'll keep all the filling material out of the mouth so you're not swallowing those chunks. We use a big vacuum that's pretty large right here at the base of the chin that's going to pull those vapors away. We cover the face, we cover the body because the skin actually absorbs a lot of mercury. So you don't want any of that happening. We cover your nose we just have an oxygen mask on so that you're not breathing the vapors in. So basically everything is just covered. And I tell people all the time, if you're not going to do it safely, it's actually better just to leave them in your mouth because you're going to get a lot more mercury removing them unsafely than the little bit that you're going to get, every single day. So make sure you're finding somebody who can do this safely.
Mm. And once you have that removed, do they then come in and fill the teeth with something else?
Yep, yep. So there's going to be a hole, obviously. So something has to go in that spot. So composite or porcelain are the two materials to use. So composite is a resin glass mixture, and it's the white filling material. If you say a white filling, that's what I'm talking about. Is that white filling material is called composite. So for a smaller area, they're going to be filled in with that. For a larger area, it's going to be filled in with porcelain.
Okay. Well, that's good to know. And then you also touched on root canals, because that is something that I know a lot of people have had and continue to be told that they should have. So let's dive into that as well.
Yep. Yeah, so this is a lot. I don't know how many where you are in other countries, but there's like 35 million done in the United States every single year. So that's a lot of root canals. And I think internationally it's probably double, triple, quadruple that number as well. The problem is all just about the anatomy of a tooth. So inside of a tooth, there's three layers. There's the outside that you see, that's called the enamel here. The next layer in is called dentin. And the third layer in is called the pulp. That's where the nerve and the blood vessels live. So the enamel part that you see is all made of minerals. The next layer in is called dentin, and there's all sorts of little tubes inside of that layer. And that's how the tooth gets nutrients clear from the inside, that blood vessel layer, all the way out to the outside. So this middle layer is it's the transportation pathway where everything goes from the inside to the outside. Well, when a root canal is needed, I always say in quotations, because you don't need a root canal. Like you can have a tooth taken out. You can do all sorts of other things. So you never need a root canal. But if somebody's recommended, you should, a tooth is dying or is dead, this tooth could have a root canal. What happens is they drill a hole into that nerve section of the tooth and then clean out the nerve all the way down on the inside of the roots. And it works okay. It works, the nerve's gone, you're not feeling anything. They fill it up with like a plastic material and send you on your way. And the idea is awesome. Honestly, the idea is awesome, right? That you get to keep this tooth that had a great big cavity or it was broken or whatever. You got to keep a tooth. You got to keep chewing with it. You got to keep smiling with it. I mean, the idea is really awesome because the options in the past were just take the tooth out. So it's great that you get to keep the tooth. The trouble is those little tubes. That middle layer, that's the problem because they can clean those main canals that go down where that third or the level layer or the pulp is, but those little tubes are too small to clean and they're too small to fill. So there's always going to be dead nerve tissue, dead blood vessel tissue in those little tubes. And that's now sealed inside of the tooth. So there's no blood supply to that. So your immune system can't get to it. People will tell me all the time, well, can't I just take an antibiotic? Well, it can't get there. There's no blood supply now. The blood vessels are gone. So that's how, an antibiotic gets somewhere is through the bloodstream. There's no blood vessels. So you can't get an antibiotic. You don't have any nerves. So you actually don't even know if something's going on inside of that area. But there's dead tissue. And anytime there's dead tissue, it always attracts bugs. And I joke and I'll say, let's say you had a gallbladder attack and the doctor said, all right, well, I know how to take care of this. I'm going to just take that gallbladder out, clean it up, fill it up with some plastic stuff, and then put it back in. Well, we don't do that. Why don't we do that? Because there's no blood supply. There's no way it's dead. It's not going to work. And it's always going to get infected. If it doesn't have a blood supply, if it's dead, it's always going to get infected. And that's what happens with these teeth. There's dead stuff still in here. It gets infected. And the body then has to deal with that infection. So it's nonstop, low-grade chronic infection that just beats up the immune system. Your body's always fighting something. So people will say things like, gosh, every cold that comes along, I get it. Well, yeah, because your immune system's super busy over here dealing with your tooth, that's always infected. It can't deal with other stuff that goes along. Or I've got an autoimmune disease. Yeah, because your immune system's confused. It's always on fighting this infection. So when other things come that just kind of oh, I don't know how to deal with you. And eventually it fights itself. So many things are connected, even cancer. Cancer is simply the body not able to deal with a cell that's growing funky, growing crazy. Why? Because the immune system's distracted, doing something else. Is it directly correlated? No, I will never say, a root canal causes cancer, but a root canal causes an immune problem, which can then lead to cancer. So many issues happen when you have this dead thing in the body that's infected that you can't fight. So, connection between heart disease, strokes, and there's research that proves all of this: heart disease, strokes, cancer, diabetes, Alzheimer's, kidney problems, on and on and on with infected root canal teeth. And the biggest issue is you don't know. The nerve's gone. You have no idea. So the way that we find these is on something called a cone beam CT scan. So it's a special x-ray, a three-dimensional x-ray that we see, and I can see everything. I can see that tooth in every single dimension. And I find 10 of these a day. Big failed, quarter size, just huge size, bone eaten away. No symptoms. Patient has no idea, but they have but they're sick. They're not well. They don't sleep well. They don't feel good. They have thyroid problems. They have other autoimmune conditions, and they would never think this is my tooth. But a lot of times it's your tooth.
Wow, mind blown. I don't haven't had to have any root canals. I'm hopefully too young yet, but I know lots of people that have. And if someone's listening and going, oh my goodness, I have a root canal, and a lot of people are tired a lot or pick up things and they always kind of just put it off to something else. So if that is the case, what do they do?
So they go get a cone beam CT scan. And where do you find that? Which doctor is going to have that? For sure, an oral surgeon is going to have those, because anybody that's going to be placing a dental implant is going to need one of those x-ray machines. So often an oral surgeon will have it, an orthodontist sometimes will have it, an endodontist, the people that actually do the root canals, will often have these. And anybody who's placing a dental implant will have this kind of machine to go and see. So you need to get one of those taken and see, is the root canal infected? Is there a problem with this? Because it's not visible on a regular dental x-ray.
And from what you're sort of saying, it's not a matter of if, it's a matter of when. It's most probably going to happen. So even if it's not infected right now, do you then recommend people get a yearly scan done to continue to check, or just have it out then?
It's really based on your symptoms. I saw a woman today and she's really struggling with just fatigue. She has such bad fatigue and she has thyroid problems. She actually has had thyroid cancer in the past. And so she's really worried about her whole system. And she had a root canal that I said, this isn't terrible. I don't see this huge abscess on it, but I definitely see some infection here around the edge. I said, it's really up to you. You could keep it for a while, until you notice more symptoms. And she's like, what else more do I need to have? I've already had cancer. she said, no, I just want the tooth out. And this is an interesting concept or an interesting thing. Obviously, in my practice, all the time, I'm telling people I really recommend, the tooth be removed, and nobody likes to hear that. But a lot of times people will come and say, I've been asking my dentist to take this out and they won't do it. Well, I need to tell you and just empower everybody that's listening here, this is your tooth. This is your body. So you get to decide. The dentist doesn't get to decide not to take your tooth out. If you say, hey, I've had a root canal, I've heard that that's not really great for me and I'd like it out. They're probably going to push back because our job as dentists is to save your teeth. Like that's what is ingrained in us, is that is our job. And if we don't save your teeth, then we failed you. And so I used to say, I will do anything to save your tooth at any cost. I will save your tooth. And now I say, I'll do anything to save your health, even if it means removing a tooth, because I can replace your tooth. I can't replace your health. So a lot of times it'll go on symptoms, where are you at symptom wise? If you already have symptoms, then you may just want to have the tooth removed. We can replace the tooth.
Mm. And for something like a root canal that really doesn't have a very good success rate from the sounds of things, is it just so popular amongst, like, it's so popular here, like Western world, essentially, because dentists are told they should save teeth at all costs, and that is an option that allows you to save the tooth, and that's why it's commonly practiced? Or do dentists just not know the risks of infection?
Both.
Okay.
So again, it's a great idea. The concept is awesome, that you get to save the tooth. I mean, who wants to lose a tooth? Nobody does. So it's great to be able to save it, but both. I mean, I probably did 1,000 root canals before I found out more about them myself. And I always remember I had a patient who I saw her and she had 3 infected root canals, and these weren't just little infections. These were big infections. And I looked on her chart and I saw that I was the one that had done the root canal. And sometimes it's hard to swallow that, that's a hard pill to swallow as a practitioner. And we don't really want to admit that maybe there are things that we did that didn't work as well as we had hoped or as well as we had been taught, that they do. So that's not always easy to understand or to acknowledge either, is that there was a problem and, things aren't working as well as we hoped. There's a lot of research that shows that root canals have a lot of problems, but we always blame it on technique. We say, oh, that person just didn't do a good job of it. Well, I can tell you, I've seen the most perfect textbook root canals ever with giant abscesses around them. So it's really not technique based. It's really just simply an anatomy. It's just the way the tooth is made. And we've tried to skirt around it and get around it, but we just can't. It just is what it is. So yeah, and a lot of dentists aren't really very educated on it. And so if you tell them, hey, I don't think root canals are good for you, they'll say, you're crazy. They're great for you because that's our education.
Mm. And I mean, sort of touching and connecting to that, a client, an older client in her late 70s, said to me the other day that she had to go get her bottom set of dentures because all her teeth had been pulled when she was 16 because she had one bad tooth. And so her parents at the time said, just get them all out. So as knowledge, technology changes over time, there's different things that come in. So when I heard that story, I was just floored. I was like, I can't believe that would even happen. But then to look where we've come from then to now, there's obviously been a lot of changes and new developments around learning about teeth.
Yep, obviously. And I really think it's important to be open to new things and new research and new studies and new everything. And I think that that's sometimes really hard in the medical world, to say something that we've done and we believed in for a long time isn't great. But patient's health is most important. What really works and what doesn't is most important. So keep looking. If you have concerns, if you were wondering about, just keep looking. That's the beauty of today's world, is that you can find information on your own. A lot of my patients come and they say, I've been to 7 or 8 doctors before I arrived here. Everybody else just thought I was crazy. You're the only one that actually listens to me. And I've learned they're not crazy. They need something and no one's been able to give them an answer. That's really what I find most everybody is just simply frustrated because there are no answers. So keep looking. Keep looking. There's doctors out there that'll do what you need them to do.
Mm. And I want to move and talk about fluoride because I feel like that's another area. I will say if we when we go to the dentist, we go every 6 months, we do not have the fluoride treatment. We have done research into fluoride, and for us, we can't find any benefits. If anything, there's only detrimental effects. But every time we go, they still say fluoride treatment, and we have to say no, no fluoride treatment. So, can you discuss the fluoride treatment and then just fluoride in general?
Yeah. So I'm glad that you haven't had pushback on that because a lot of times people will get pushback. They'll say no fluoride treatment and they'll almost get guilted or shamed into doing it. Well, what? You're going to get a mouthful of cavities and, how could you say no to that for your children or, whatever. And so good job standing up for what you feel is right. Let's go back to kind of the history of fluoride too, because I think it's really important to just know where it's come from because it helps explain where it's at today. So clear back in the 1930s, researchers found that areas that had naturally high fluoride, so these were people that were drinking well water, wells that had, they're drinking well water that had a lot of fluoride in it, that they actually had really strong cavity resistant teeth. They also had splotchy, white, not very attractive to kind of brown, splotchy white teeth that didn't look so great, but they didn't get cavities. So they said, oh, this is interesting. All right, fluoride must make stronger teeth. So they started researching and they found it was true. Fluoride actually makes stronger teeth. Why? Well, the enamel, like I talked about, is made of a mineral complex called hydroxyapatite. And in the presence of fluoride, the fluoride actually pulls the calcium out and takes its place. And so it creates something called fluorapatite, which is stronger than even natural tooth structure is. So it is true. Fluoride does strengthen your teeth. Absolutely. But that's not the end of the story. That's the problem. So then they decided, okay, fluoride's great. It's going to strengthen teeth. Well, let's just solve everybody's cavity problem. Let's just put it everywhere. Let's put it in all of our toothpastes. Let's do fluoride treatments when you go to the dentist. Let's put it in our water. Let's put it all of these different places because it's going to prevent cavities. The concept was good. Again, it's like a great idea, but it didn't work. People still get cavities, right? People still get plenty of cavities. So it didn't work as well as we'd hoped it would work. It didn't eradicate cavities for everybody, everywhere. So that's problem number one. It does make teeth stronger, but it doesn't prevent cavities entirely. There's other things that go into why we get cavities that have nothing to do with fluoride. The second problem is fluoride doesn't just stay in your teeth. So fluoride, even if you have it in your toothpaste, if you have it in your water, if you're doing fluoride treatments, you're swallowing some of that. Some of it is getting into your bloodstream. You're getting it into the rest of the body. And fluoride has effects in the rest of the body. So this is what you were talking about. So it does strengthen teeth, makes them stronger and more brittle. It does the exact same thing to bones. It takes the place of calcium and replaces calcium with fluoride and makes them stronger and more brittle. Well, can you see a problem with a brittle bone? Yeah. So areas that have high fluoride have higher risk of fractures because that fluoride creates a brittle bone. So stronger, more brittle is bad when it comes to bones. That's problem number one. Second problem is that fluoride is very similar to iodine. If you look on the periodic table, they're cousins. So iodine is what activates thyroid hormone. You have to have iodine in your system to be able to activate your thyroid hormone and feel the energy that you need. Well, fluoride will bully iodine out and will activate the thyroid hormone instead of the iodine. But when it's activated by fluoride, it doesn't work. You don't get the energy that you need. So a lot of people have symptoms of low thyroid activity, but they have tests that just say they're fine. Why? Because the fluoride is interfering with the thyroid and the way it works. And this used to be a treatment for hyperthyroid. So somebody who had too much thyroid activity, a treatment used to be given fluoride. So this has actually been known for 50 years or more. The thyroid interferes with thyroid, fluoride interferes with thyroid function. I was diagnosed with low thyroid when I was 21 years old. And my dad's a dentist. I grew up with fluoride treatments, fluoride toothpaste, fluoride swish, fluoride, everything. I'm like, how much of that contributed to my thyroid problems? Probably a ton. And then if that's not enough, it gets even scarier. There was a brand new study that just came out, probably, a month ago, maybe a month and a half ago, that showed that in areas with higher fluoride levels, there were IQ drops in children, and they could quantify it. If you had this much fluoride, you had a point decrease in your IQ. This much fluoride, 2 points decrease in your IQ. So it was direct correlation. Higher fluoride, lower IQ in children. So we know it's causing developmental changes and problems with the brain. So, all right, it didn't stop cavities. It leads to brittle bones, thyroid problems, and IQ issues in children. Is it worth it? No, because it didn't solve the thing it was intended to solve. And here's the cool part. We now have a solution. Remember that hydroxyapatite that your teeth are made of? We now have tooth products that have hydroxyapatite in them. So instead of fluoride, we just put back what was lost. Because all a cavity is when either acid on the tooth pulls minerals out of the tooth, or your body doesn't have enough minerals and it pulls minerals from your tooth. So some reason minerals leave the tooth, leaving a hole, which bugs crawl into. Then they eat sugar, excrete more acid, create a deeper hole, and basically the hole gets bigger, bigger, bigger. That's what a cavity is. So what we need to do to fix a cavity is just put minerals back in the hole. That's it. Because that's all that happened is minerals got pulled out, left a hole. Well, let's just put minerals back. We were putting something back that never came out, fluoride. It was never in the tooth. So now we can just put back hydroxyapatite, which is the thing that left the tooth to cause the cavity. And research now shows that hydroxyapatite is just as effective, if not more effective than fluoride in rebuilding teeth and strengthening teeth. So there's no reason for fluoride ever again, because we have an option that is better and doesn't create side effects. So good job. You were already ahead of the game on this one.
Yes, but every dentist we go to said, you need the fluoride treatment, you need to have the fluoride treatment. And, like you said, you do get pushback, and we take our two girls and we've had pushback, and then they're like, oh, make sure you're using a toothpaste with fluoride then. And I'm like, well, no, I'm not. But again, why is it so widely accepted and, forced upon people essentially?
Because we're just taught, as dentists, we are taught that that is the way we are going to save teeth. Remember, that's our job, save teeth. And this is how we're going to do it, is through fluoride. And then if you don't do that, then you're going to have cavities, and now it's our fault. It's not true, but it's what we're taught.
Yes, it's not good. And, you do have to do a lot of your own research, but then a lot of people will do that. And then they speak to their practitioner, and their practitioner will be, no, whatever. I've had that before. I've taken stuff into my doctor, and they'll be like, oh, no, where did you find that? That's not right. And it's like, but, another doctor is saying this, so why isn't it correct?
Yeah. 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 It's really frustrating. And it was interesting when this new fluoride article came out. I was on a whole bunch of dental forums, and a lot of dentists were saying, oh no, everybody, can you put on here all your articles about fluoride, pro-fluoride articles? And, we got to beef up for these questions that we're going to get. And I just responded and said, why are you doing that? Like, why can't we just look at the research for what it is and say, maybe we were wrong and maybe we need to reframe the way we look at this. And maybe we should be the ones that say, hey, guess what? We have an alternative to fluoride. We're not going to push it on you. We have something else that's even better. So I'm trying to push the dentists, but honestly, it's not going to change from inside of dentistry. It's going to change from being exactly like what you're doing. From you saying, hey, I don't feel good about fluoride. And actually, there was this new research article. Here it is. It was on PubMed. This is not just somebody like my neighbor told me about their cousin's husband. This is like a PubMed researched article that says this and this and this. Here it is. This is something I feel really strongly about. Thank you for supporting me with this. And just if enough people do that, then hopefully enough dentists will sit up and say, if we want people to come here, maybe we should have some options. So I obviously try to teach dentists options and how to provide these things for patients, but all of you keep asking for something more, something better, something different. They'll have to sit up and pay attention.
Yeah, I'll have to print out the article and take it into the dentist next time.
They'll love you even more, believe me. They'll love it.
Wow. So we did touch on cavities, but can we discuss, what people can be doing to prevent them. I mean, I'm sure people know they should be brushing their teeth and they should be flossing, but are there any specific things that we really should be focusing on?
Yeah. So the biggest key is that you want minerals in and no minerals out. So let's talk about those two things. So minerals in, what are you going to do? You're going to do hydroxyapatite on the outside. And hopefully there's products, people ask me all the time, I can't get your products in, wherever I am. And I know, but there are products coming on the market now. So you're going to look for something with hydroxyapatite. That's what you're going to use for the outside and making sure you're getting lots of minerals into the teeth. So that's key number one. The second one is minerals in. So let's talk about this too, because people don't realize this. In fact, I saw another woman today and she was so frustrated. She said, I've always had cavities, no matter what. Every single time I've been to the dentist since I was a young kid, every time I had 2 or 3 cavities. And she had a beautiful mouth. She didn't have plaque. She brushed, she flossed. I mean, she did all the things that you know to do. And I said, all right, this is something obviously different than brushing and flossing. That's not your problem here. And honestly, sometimes, yes, sometimes I look in a mouth and I can tell that they have not brushed very frequently or well, and I said, okay, let's start with brushing. This is a great place to start, and with kiddos, obviously that's a place to start too. But if you're already brushing, if you're already cleaning, if you're already doing what you need to do, and none of that's fancy, none of that's like, everybody knows that. Brush your teeth. Clean your teeth. Everybody knows that. But what if you still get cavities? What's going on? 2 possibilities. So one is the minerals. And you can take minerals, but you actually have to absorb them. And so this is the piece that a lot of people don't know about and don't understand, is that the way our body absorbs minerals is it hits the stomach. So if we eat something, let's say, we eat some vegetables that have a lot of mineral content. We eat some strawberries, some spinach that have a lot of calcium in them. Bananas with potassium. We eat all these really great foods. Well, when we eat them, that food hits the stomach acid, and the stomach acid actually ionizes or changes the mineral so that the body can take it up and put it where it belongs in cells. So if you don't have adequate stomach acid, the body actually can't change the mineral to make it absorbable, and it just goes through to the other side. So if your body is deficient in minerals, either because you're not eating enough of them or you're not absorbing enough of them, then your body will actually take the minerals from your teeth and your bones to run its other systems. This is something people don't understand because there's only so much to go around, and hearts and brains are required for life. Teeth aren't. Body prioritizes. It knows if I only have so many minerals, I'm going to have to use them for my heart and my brain, and the teeth are going to have to fall, they're going to have to fail. So the teeth, literally the body will pull minerals out of the teeth. And I see this every single day. So I have a super easy test you can do at home to see if you have enough stomach acid to actually do this job. So this is kind of a fun one to do. It's like a science experiment. You take a 1/4 teaspoon, and I don't know what your equivalent measurements are. That's like a little bit. I don't know how to.
We use teaspoons, so yep.
Oh, okay, perfect. I don't even know. In the U.S., we use all the different measurements than everybody else does. So teaspoon, a 1/4 teaspoon of baking soda, and a 1/2 cup of water. So that would be 4 ounces of water. So a 1/4 teaspoon of baking soda, 4 ounces of water, and you're going to drink it. Then you're going to time to see how long it takes you to burp. So you want to see how long it takes to have a burp come up. And you want to be burping in 2 to 3 minutes. What in the world is this doing? That baking soda is interacting with the stomach acid, and it should create a chemical reaction, and you're going to get a burp in 2 to 3 minutes. If you don't burp in 2 to 3 minutes, you don't have enough stomach acid. If you don't have enough stomach acid, you can't ionize your minerals, and you're not getting what you need out of your food. So you may be eating the most beautiful diet in the entire world, but it's going right out the other side. So you have to make sure your gut is working. If you don't burp in time in 2 to 3 minutes, it means you don't have enough stomach acid. You may have to supplement with stomach acid while you are working through repairing. So you can check this out. If people want to go on my website, there's a free assessment on there. You can go take the test. There's the information about the baking soda test, and there's information about what to do about it if whatever you find on this test. This is huge. I see this every single day. So you're brushing, you're flossing, you're doing great, but you're not absorbing any minerals, and your body is pulling them out of your teeth to be able to take care of your heart and brain. The two big times this happens is pregnancy and, well, three big times: pregnancy, teenage years, and menopause era, kind of 50, 50, 55, 60 time. Why? Well, pregnancy makes sense. Well, pregnancy and teenage years both make sense. You're growing bones. You're growing a human. If it's pregnancy, you're growing a new human, or nursing, both. If you're teenage, you're growing your own human. Your bones are growing. Well, what does it take to grow a bone and grow a human? A lot of minerals, right? So if you only have certain amount as a pregnant mama and you're growing a human, your body will always prioritize your baby. So your baby will get more and will pull minerals from you to feed baby. This is why so many moms tell me, this crown and root canals from this baby. I lost this tooth after this baby. These three cavities over here from this baby. They can like name their cavities based on their kids. Why? Because they simply didn't have enough to go around for everybody. So that's one of the big ones that a lot of people don't understand about keeping teeth healthy, is make sure you're getting enough minerals. So you do minerals in, that's going to be a mineral supplement. Plus, people don't understand this either, that you have to have vitamin D and K, D3 and K2, to actually be able to utilize those minerals. So D3, K2 and minerals in, hydroxyapatite on the outside, and make sure you're getting enough of them. Make sure you're actually absorbing it. Otherwise, you're going to still get cavities. So that was a long-winded answer for how to keep your teeth healthy. But basically, people need to understand there's ways, and there's things other than just brushing and flossing.
No, but it's very informative. And then my brain is going to, I wonder if there's any correlation with people that suffer from like acid reflux and things and not having enough minerals in their teeth. So then they go on medication for the reflux and how that would affect it as well. So,
Thank you for bringing that up. Yep, because guess what? A lot of times reflux, people think that's because they have too much stomach acid. So they go on medication to decrease the stomach acid. When they go on medication to decrease stomach acid, what have you just done? You just made it so you're not absorbing minerals ever again. So you're going to be nutrient deficient from now on, as soon as you go on medication to decrease stomach acid. And here's the crazy thing. The symptoms you have are often because you have too little stomach acid. Because if you have too little, the food ferments rather than digests. It just sits in here and gurgles, and that acid comes up, and you feel it like that burning in the back of the throat. But it's not because you have too much, it's because you have too little. But now you take medication and you make the problem that was there, which is too little, even worse, because it shuts off the stomach acid production.
And that's what's going through my brain, thinking about that. And then also thinking about generally when people are having some issues with reflux, there's generally a diet, component of it. They may be eating a lot of processed foods or, a lot of foods that are higher in fat and sugar and maybe not enough of the sort of whole plant-based types of foods. And so then thinking about cavities and sugar intake, that may contribute potentially as well.
100%. Yep. So it's just like a double whammy. You have sugar that's creating acid in the mouth, which is dissolving more minerals. Your body itself isn't absorbing minerals. And yep, you're thinking right.
Well, this is why holistic health and functional medicine is so important, because everything in the body is interconnected and getting to the root cause is what's most important.
Yep. Yep. Love it.
Now, I want to ask you about oil pulling, because that seems to be a trend people are doing currently as well.
Yep. So oil pulling is all about the way bacteria or viruses or whatever it is, whatever bug it is, every single one of those things, every single microbe or bug is surrounded by oils. So are every single one of our cells. The outside is called a fatty membrane. So the outside of every single cell, bug or yours, either one, is surrounded by fats. And when you get fats with fats, they will actually attract to one another. So when you're oil pulling, what you're doing is you're putting usually coconut oil or sesame oil. I like coconut oil because it doesn't taste very much. It's kind of a little flavorless. Sesame oil is kind of strong. So you put about a tablespoon of oil in the mouth and you swish, literally pull it through the teeth everywhere. What are you doing? Well, you are pulling bugs from every nook and cranny in the mouth because that fat attracts fat. So it's going to pull into that oil and it's going to attract bugs out. So you're pulling it out from all the different nooks and crannies and hiding places in the mouth. Now, this mouthful of oil that you have is going to be full of gross stuff, right? So you're going to spit it out. Typically, you oil pull for about 10 minutes. You swish it through the teeth and the mouth for about 10 minutes, spit it into a tissue and throw it away. Don't spit it into your drain, otherwise you're going to clog your drain. Um, I was doing this for a little while, and I would do it while I was cooking my kids breakfast, doing other things. I'm just swishing around in my mouth, and then I would just go off the back porch and spit it onto a little patch of grass over there. Well, the grass died. It completely died. And I was like, wow, that's some bad stuff I'm spitting out right there. I better spit in the Kleenex from now on. But I don't recommend doing it every single day because it's going to pull all the bacteria out of the mouth, not just the bad guys, the good ones too. And the concept behind it is that we want to balance the bacteria. So you're going to pull a little bit of all of them at first, which will make it easier for the good guys to fight the bad guys because there's not as many. So I recommend doing it for 3 days in a row and then only about every third day after that, just as kind of a maintenance thing. Do you have to do it? I don't oil pull. I do have some patients that I recommend it for if they have gum disease. Particularly, this is a good one to do. I feel like what I do with just my regular old toothbrushing and mouthwash is good to keep my gums healthy. But some people, they need some extra help and they've got a lot of hiding places. If you've had a lot of dental work done, you have a lot of crowns or, gum recession, things like that, places where bacteria can get that it's just hard to get to, with a toothbrush or floss or whatever, it's just hard to get to it. Then oil pulling is a great way to do it because they can get into all of those spaces.
Well, I think that's very good information for people to know. And then the other question I have was on tongue scraping because we tongue scrape, and I think that's made a huge difference to my dental, like my teeth. I think I don't know if it's 100%, but just with staining and things like that. And then also just overall health. I don't think I get as sick as what I used to get now that, I mean, I've been doing it for years now, but prior to that anyway.
Yeah. Yeah. I always joke that it's kind of like big, thick shag carpet if you look at your tongue. Like there's so many nooks and crannies all over the tongue and places that things can hang out. And it's found that there's a lot of, especially fungus that stays on the tongue. So when people have chronic fungal infections, chronic sinus infections, scrape your tongue. And people will tell me all the time, oh, no, I brush my tongue. So if that's you, I'm going to challenge you. I want you to brush your tongue and then I want you to scrape your tongue. And I want you to see, is there more stuff that comes off? And there will be more stuff. You cannot get it off with just a toothbrush alone. So tongue scraping is really important. If anybody has geographic tongue, it's called geographic tongue, where it gets very sore, especially with acidic foods, and kind of has these weird little patches that move around. I actually had that when I was in my early 20s and I didn't know what to do about it. Finally started tongue scraping and it went away. And it's literally come back once during, I don't know, probably 30 years time. So I believe that it's called geographic tongue. I believe it's a fungal problem. I believe that this contributes to canker sores and other gum disease. I believe, and it's an old Ayurvedic technique, oil pulling and tongue scraping, both are from India. And they believe that it helped balance the oral or the whole biome in the gut, all of this when you're keeping the tongue clean. So it's something I do every single day.
Good. I do it every day. So, and I found it made a big difference.
Good.
And then the sort of the third, I guess, sort of wellness one I had to question about is there's a new kind of trend where when people are trying to balance their blood sugar levels, they're putting generally like a teaspoon of apple cider vinegar into a glass of water and then having that before their meal to help lower the blood sugar spikes from the meal. So speaking to a dentist, is there any detrimental effects from the acidic nature of the vinegar, or is because it is dissolved in that glass of water, it's okay for the teeth?
So for sure, the vinegar is going to be problematic to the teeth if it's in contact with the teeth quite a bit. So the problem I see is when people say apple cider vinegar is good for blood sugar spikes. So I'm just going to put apple cider vinegar in all of my, in my water that I drink throughout the whole day. Or lemon water is the one that a lot of people do as well. I'm going to put lemon in my water first thing in the morning because it helps to alkalize my system, which is true. But if it works then I think I'm just going to put lemon in my water all the time. And so every water I have, I'll put this in. That's where I see the problem coming, because what that acid does is it dissolves and pulls the minerals out of the teeth. So it's exactly what we were talking about. Any acid will pull minerals from tooth structure. So the more acid you put in your mouth, the more likely you are to be able to lose minerals. So if you're doing it just at the beginning of the meal, and then you're following it with, your meal and everything else and plain water, and you're not going to put more acid in, then I think it's probably not going to be damaging. But if it's something you're doing on a nonstop basis, you're always adding a little vinegar, a little lemon juice, a little something to your water, that's actually very dangerous. And some of the electrolyte drinks, a lot of electrolyte drinks are very, very popular too. Those are very acidic also. So all of those things along with soda, I mean, anything that has kind of a little bit of a bite to it, that acidic feel, just think that also is pulling minerals from your teeth. That's what those acids do, is they just pull minerals out. So as long as it's in moderation, just once at the beginning of the meal, you're probably okay. But if you start doing it more and more, your teeth are going to suffer from it.
Mm. Well, that's a good answer for her. I have a few people that had been asking about that. So I thought that was a good one. And it has become, one of the sort of wellness trends to do now, with people being a lot more aware of their blood sugar levels and stuff too. And then finally, this may be a little bit sort of outside your realm, but having kids that, my girls are 9 and 11. And on our most recent visit to the dentist said to us, she's just lost, my 11-year-old's just lost her last tooth. So, and her teeth, they're not really crooked or anything, but they said, oh, you might want to start thinking about braces now. She's just lost her last tooth. So as a parent who may have kids that, are getting to that stage where the dentist is saying they should get braces, what's your opinion as a dentist with when they should get braces? And is it better to get it when they're younger or when they're older? Because I know from my experience, I didn't have braces when I was younger. My teeth were quite straight, and then I got my wisdom teeth around 18, 19, and then I had some crowding issues start to happen later on.
I think the biggest key is, why are we getting braces to begin with? Like, what's the problem with that? Why are people's teeth crooked even now? We'll look at skeletons from 300 years ago, and they had all of their teeth, wisdom teeth included, and everything was straight. So what's changed? What's making a difference here?
Breathing.
It's usually, and the breathing even goes back further than to diet from the very beginning, the very beginning diet. The very first bone that's affected by malnutrition is the top jaw. And when we say malnutrition, it's not because we're all starving because we don't have enough food. It's because our food doesn't have high nutrient levels in it. So we may be eating great food, but it might be that food is actually very deficient just because the way it's grown nowadays and the way it's processed and things. So the first bone that is affected by malnutrition is the top jaw, which means now we're all getting crooked teeth. All of our teeth don't fit in the mouth as well anymore. And even as a young child, some of the signs that you can start looking for developmentally that are really problematic are any kind of snoring whatsoever, tossing and turning, grinding teeth, bedwetting actually is one of the signs, and ADHD symptoms, kind of lack of being able to focus. All of those tell us that they are not getting enough air. And why are they not getting enough air? Because the mouth isn't big enough to house the tongue and everything else that needs to fit up here. So it ends up falling back into the back of the mouth. So this is the biggest problem with crooked teeth, is crooked teeth are a sign that there's not enough room in the mouth for everything that's supposed to fit there. And if there's not enough room, then that stuff's going to fall back into where we're trying to breathe through. And we get kids with all sorts of developmental things happening because they're not getting enough air. So we start seeing learning problems and all sorts of things happening because the brains aren't really able to get as much air as they need. That's the biggest reason that we see for doing braces, is it's a sign that there's not enough space in the mouth. So if the teeth are crooked, they need to make more space for the tongue and everything behind the teeth to fit. That's the main purpose that we talk about braces. And we have a whole department or office that does this. Um, and I 100% would rather do it when they're young because they're still growing. So when we're able to do it when they're young, we're directing the growth to be wider, bigger, more space for everything versus older. Now we're having to widen things and make more space, but there's no growth to utilize. So we're working kind of against the, upstream rather than downstream, and we're working with kids. So 100% do it when they're younger. Typically it is, if there's breathing issues, if there's sleeping issues, focus issues, bedwetting. What does bedwetting have to do with it? Bedwetting, if you're not getting enough air at night, it actually changes, creates more what's called ammonia in the bladder, and that's very irritating. So then the bladder is going to empty. So if you're not getting enough air, we'll get kids that are bedwetting into later years, into 8, 9, 10, 11, 12, because they're not getting enough air. So if you're seeing these kind of symptoms, we even start doing expansion and ways to help direct the growth young, like 5, 6 years old, because we want to try to help them while they're growing, help them get more oxygen. If there's no symptoms, then typically once those last baby teeth come out and first, last permanent teeth are coming into the mouth. So sounds like about where your daughters are.
Well,
Absolutely use the growth to be able to get what you need.
yeah. Well, she doesn't have any symptoms or anything like that. And, I've always said to her, utilize your nasal breathing. And I think it was James Nestor's book on breath. And he talks about even making sure diet-wise that you are having to choose foods that are tougher so that you can chew and develop those jaw muscles, which are also going to help sort of just with the positioning of the teeth and that too. So,
Yep.
Having all that in mind, it's still, I think nowadays, everybody does want the picture perfect straight teeth. So, as soon
Yep.
as they hit that age, they already sort of start mentioning it. And to be honest, it hadn't really crossed my mind. I just thought, oh, aren't you a bit young to be, you're only in grade 5 at primary school. Do we talk about this yet? So they said, yeah, just go off and have a think about it.
Yeah. Yep. Utilize the growth. It's a good time to do it.
Now, before we finish off, I always like to ask my guests that if there is one piece of health advice that you could give to our listeners that after listening to this podcast, they could go off and instigate straight away, what would it be?
So switch out your fluoride for hydroxyapatite. That's the biggest one that I always say from a dental perspective. So go find something that's hydroxyapatite instead of fluoride and just switch out everything for that. Your body's going to thank you for it.
Amazing. Well, great advice. And I'm happy to know that I'm on the right track. I just need to
Yes, you
get some
are.
of your products now. Now, before we end the podcast, can you please share with listeners where they can reach out and connect with you and work with you as well?
Yep. So Living Well with Dr. Michelle is what my website's called. Go on there. There's all sorts of free information on there. That's where you're going to find the gut health test and the gut health guide and all of those things there. So Living Well with Dr. Michelle. And also my dental practice is called Total Care Dental. So go check that out as well. If you have dentists that you would like to learn, I have training programs on the Living Well with Dr. Michelle site. Lots of information. Just go check it out. YouTube channel there also. Everything Living Well with Dr. Michelle, and lots more than what I've shared today. So go check it out if you're interested.
Amazing. Well, thank you so much for coming on the podcast and answering all my personal questions as well as listener questions that I had been given. It's been a pleasure having you on.
Thank you.